Hey guys, today we're going to talk about diastasis recti. You've probably heard the term before. It's a pretty popular term among pregnancy, postpartum moms groups, and just social media in general has kind of been posting information about what is a diastasis. Some things are true, some things are not so true. So first off, I just want to explain what a diastasis recti is. So you have two muscle bellies called your rectus abdominis that really run from about here down to your pubic bone. So you have a right side, a left side, and then the middle of it is connected together by something called the linea alba. So when you're pregnant, if you've ever noticed that dark line in the middle of your stomach, that's the linea alba. It just turns dark when you're pregnant because of hormones. And then we call it a linea nigra for a little bit. Anyway, with weight gain, excessive weight gain, or pregnancy, people can sometimes develop a diastasis recti. It's fairly common. We don't really consider it to be pathological or a problem until it's 2 fingers wide or 2 knuckles deep. So anything less than 2 knuckles wide or 2 knuckles deep is really not considered something to be much of a problem. However, if when you're doing your core exercises, your abdominal contents are kind of bulging out through that space, that is something to avoid or to seek help for. So I'm going to show you today how to check for a diastasis recti. If you have one, don't freak out, they're very common. Typically they improve as much as they're going to improve on their own within the first year postpartum. If you go past a year postpartum, what you have is probably what you're going to keep unless you do some type of physical therapy or have surgery to correct it. Typically we don't recommend surgery until you're done having kids, and only recommend it if physical therapy has failed you. So with any core strengthening that you're doing, you just want to make sure that you're not bulging through your gap. If you look down and you can do sit-ups and there's no, doming or coning through the middle of your stomach, then you're fine. And if you want to start off with some gentle core strengthening exercises, I've posted videos on what I called level 1 core strengthening. So I'm just going to show you how to check for a diastasis recti today. And if you have any questions, feel free to post them. But always, I recommend seeking the help of a pelvic floor physical therapist or a women's health therapist, somebody that's comfortable with treating diastasis recti. So, to check it, if you lay on your back, okay, you're gonna find your belly button, and then you're gonna dig 2 fingers in to your belly button, okay? Let me actually show you this way. Okay, so you're gonna find your belly button, dig your fingers in side by side, push them in, do a little bit of a sit-up, and see how many fingers fit in the gap. So I don't really have a diastasis, and you can see I don't have any bulging. Some people will have a cone right here in the middle where their diastasis is. Okay, so we're measuring how wide it is and how deep it is. So after you check at the belly button, then you're gonna go a couple inches below the belly button. Okay, do another sit-up, see how many fingers fit in there and how deep it is. And then you're gonna come up here, kind of between the ribs, dig your fingers in, sit up, and see how many fit. Typically people have the largest split between the belly button and the xiphoid process up here. Most people don't have as big of a split down below. And that's usually just because we carry our babies, in this section. This part doesn't stretch as much because we are usually, most of our pregnancy, that stretch is happening up here. So if you have any questions, feel free to post them, but hopefully that is some helpful information for you.